New tonight, New Yorkers with disabilities and the people who support them are on the clock. The deadline to apply for continued benefits under a revamped $9 billion Medicaid home care program is rapidly approaching. Our Dylan Morello joins us to explain what the program is and why neighbors are concerned. Dylan.
Trina, the Consumer Direct Personal Assistance Program, CDPAP, allows New Yorkers to hire family or friends as paid caregivers for those with disabilities. And while the service isn't going away, the governor recently announced overhaul on how caregivers get paid is causing concern from neighbors who say this could leave their disabled loved ones without service.
We're at a crisis situation right now. It could be prevented.
This change, stemming from last year's budget, now makes a single statewide facilitator of payroll to handle workers' Medicaid payments, benefits, and maintain records, down from over 600 plus intermediaries. Neighbors have raised concern about this new facilitator, Georgia-based Public Partnerships, LLC, a company that has been accused of wage theft and delaying home care workers' pay in other states. PPL told CBS in a statement the allegations are mischaracterizing a lawsuit that is addressing who should pay overtime in a sole employer consumer direction model.
I believe CMS could act in a way that kind of stops things and let people reevaluate the whole picture. Keep the services in place. Let's review what's going on.
The state says the change is due to massive fraud and waste that added millions in Medicaid cost, saving millions of taxpayer dollars. The governor says the overhaul won't change eligibility or timely payments. A parent of a disabled child who used a caregiver says the process to enroll in this new system is cumbersome.
She's not been able to get the training that they said or the app that is required to sign in and out. And we do not know of anybody who's made it this far who's received any training.
She's worried her son could be forced into nursing homes or emergency rooms if left without help after the deadline.
Just imagine the days I'm sick or I'm not able to do it as fast as I should be able to do it, and you're watching your loved one suffer. It's brutal.
Over 700,000 consumers and workers are in CDPAP. The state says over 115,000 each of consumers and workers had either started or completed registration as of March 10th, which leaves 67% of current users in need to register in the next 16 days or risk losing care and employment.
It also risks putting a lot of these caregivers on our unemployment system, and it also risks flooding our hospitals with people who are being cared for at home. And I don't think our hospitals are aware of this potential crisis unfolding.
Lawmakers across the state have called for the April 1st due date to be pushed back. Nothing has come of the ask as of yet. We'll have steps on how you can enroll in the new program on our website. In the studio, Dylan Morello, News 4.